Parents, in this episode, we discuss sexual health disparities. If you haven't discussed this topic with your children, please listen first and then listen as a family.
Hi, and welcome to the Let's K12 Better podcast. This podcast is a project between Mom of All Capes and her kids.
Hi!
In our podcast, we will cover a variety of subjects involving K12 education and family life. We will talk about the ways that parents, kids, and educators can improve K12 education and family life.
We encourage you to join our conversation on social media using the hashtag Let's K12 Better.
Let's jump into episode 12 of the Let's K12 Better podcast. I remember being determined to have my last daughter without Pitocin and without an epidural. Something in me wanted to see if I could just do it. My first two natural births included a late epidural that fully kicked in after I delivered my child. Quite a strange feeling. So this time around, I sat down with my children's father to bring him in on my game plan, and he was on board. But the entire time I was in labor and delivery, I was pressured by the anesthesiologist, a white man in his 20s, to get an epidural. He seemed to appear on the hour, every hour, to tell me to, quote, stop being tough, or that he thought I was torturing myself for nothing, or that the drugs were made for a reason. And the nurses in the room, they knew my game plan, but they said nothing. I looked at him every single time with tears in my eyes and rage in my heart and just said no. And the final time he darkened my door, he was laying it in, until my children's father stepped in. Why did it take a man to make this guy listen to my needs? Needless to say, I delivered Sophia without an epidural. It was a beautiful experience that I'll never forget, but I'll always remember not being listened to. Black women and trans people face health disparities at disproportionately higher rates regardless of income level. I'll speak to the experience of a Black woman. If you recall Beyonce and Serena Williams, they both discussed their horrific labor and delivery experiences candidly with the media. A closer look at COVID-19 shows that Black people are dying at disproportionately higher rates due to pre-existing conditions, healthcare inequities, and, as Pew Research Center puts it, work and residential circumstances, which is code word for poverty and income level. And the healthcare issues experienced by Black trans people are invisible to mainstream media. Wellness and sex health include much more than abortion rights and birth control mandates. Wellness and sexual health are at the center of how to improve our society. Improving outcomes for families means we must centralize the needs of women and children. Improving outcomes for all people means we must candidly discuss wellness and sexual health advocacy in our homes. This requires us to not only address and eliminate implicit bias in individual doctors, but to also address and eliminate the hurdles present in the lives of those living at the margins. Improving their experiences improves healthcare for all of us. In this episode, we meet with Renee Pitter, MPH, who has dedicated her life to wellness and sexual health advocacy. We hope you're inspired by her words to join the effort to make wellness and sexual health a more equitable and racially just experience. We are delighted to have Renee Pitter, MPH, Research Program Manager for the Center for Sexuality and Health Disparities at the University of Michigan, join us today. Welcome to the podcast, Renee. We are so excited to have you. Thanks for joining us.
Thank you so much for having me. I am completely honored. This is delightful.
We can't wait. This is going to be a great discussion. So we're just going to jump right in and start off with our first question.
You work in the area of sexual and reproductive health and disparities. Can you give our listeners a brief overview of what this field is?
Sure, Naima. Thank you for asking that question. So we talk about health. I think I'm going to start with a couple of definitions to help people to get an idea of what this field is about. So when we talk about health, the definition of health that comes from the World Health Organization, it describes health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. And so we talk about health, we're not just talking about not being sick. We're talking about overall wellness, thriving, living your best life, working to your highest potential and capacity, and feeling the best you can possibly feel. That's what we mean when we talk about health. And when we talk about sexual and reproductive health, we are describing what are the requirements for somebody to have a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasure and being safe while they're having sexual experiences, free from coercion, discrimination, or violence. So that means that people being able to engage in physical activities with other people, where they don't feel forced to do it, they don't feel like somebody's going to hurt them, and that they can do these things that they want to do, that they agree to do safely and with enough agency to be able to make their own decisions about that. And when we talk about reproductive health, we talk about people being able to decide whether or not they want to be able to reproduce or have a child. So when somebody's having sex, they can decide if they want to have a child or if they don't. And for people who maybe want to have a child but they're having trouble, that's also an area that we focus on to help people to be able to reproduce if they want to. And so when we talk about health disparities, we talk about some differences that we may find for certain groups, and groups who have either been historically denied some privileges, or people who we find over time often tend to be more sick than others for systematic reasons, either because of race or where they live or who they are, their immigrant status, who they're attracted to. So sexual minorities, people who may be gay. And so the work that I do is to make sure that we have equality across every group, not just that one group is more sick or one group is less sick, but so that everybody can work to be as healthy as they possibly can be.
Really important work. It sounds like a ton of activism is involved here, to ensure that everyone is living and is healthy in an equitable way. So, thank you for that definition. Okay, so we're going to move to our next question.
How did you become involved in this work? What's your origin story?
Thank you, Sophia, for that question. So my origin story is that I wanted to be a superhero when I was a kid. I'm kidding, kind of. My origin story is that from an early age, I was a very observant child. I talked a lot, but I also paid attention to things. And I'm sure that the three of you, Sophia, Garvey, and Naima, you guys are paying attention to things that are going on. You watch things on TV and you may think like, why does that happen? Why does that particular group of people always end up on this cop show? Or, those kinds of little questions that you have. And so when I was your age, I noticed those things, and I didn't really have the language to ask the type of questions. Sometimes I would ask my mom questions and she would give me really great answers. But it wasn't until I went to, obviously, when I was going to school and high school, that I started to have the language to formulate those questions. So one of the things I noticed was about race in America, and partially was because I had something to contrast it to. So my family's from Jamaica, which is a majority Black country in the Caribbean. And I noticed that Black people in America were treated differently than Black people in Jamaica. And so I would always wonder, like, what is going on? Why are Black people in America, it seems like they're poorer than white people. It seems like when I would go to my classes sometimes for my advanced classes, I would see less Black students than white students. And when I looked at poverty in Jamaica versus poverty in America, I noticed that there was a big difference, right? And so I started to take classes to help investigate those kinds of things. So when I was in high school, I took a sociology class and I learned about society and the way that society has been constructed for certain people to benefit and for some people to not. And that's a very simplified explanation for it. And so after I learned that, I wanted to learn more. So when I went to college, I learned about African American studies. I learned about political science and the ways that societies are set up and the way that political systems work. And then from there, I thought I was going to go into politics. And so I did an internship with one of the congressmen, Richard Durbin, out of Illinois, because that's where I'm from, Chicago. And I worked with one of the interns who looked at issues for Black communities in Chicago. And I learned about some of the health disparities that Black communities were facing, and one of them being HIV at that time. This is in the early 2000s, before we had medication, the types of medications that we have for prevention and treatment. And I noticed that women in my age group, the leading cause of death at that time was HIV. And that scared me. And I said, oh no, why are young women in my age demographic and my race dying at such a high rate? And so I wanted to investigate that, and I took more classes. And I took a class on race, gender, and health in undergrad. And that is when I had the opportunity to go back to Jamaica, where my family's from, and do HIV prevention work there. And that was teaching people about HIV, how it worked, how it was transmitted, how it could be prevented, and things that you could do to stop the spread of it. And then from there, the next year I took a trip to South Africa to do the same program, but in South Africa. And it was interesting. It was absolutely interesting in Jamaica, but also interesting in South Africa because the rates were so high and I didn't understand why. And being there, I got to learn more about the disparities, about differences of the way that medications are rolled out, how people are accessing healthcare. And that's what led me to go to School of Public Health and learn even more about that as well.
So it sounds like you did a ton of pursuing of knowledge and just investigation like into this topic, which then leads us into the next question of like why investigating and like why learning more is so important. We want to really drive that point home to our listeners.
Sometimes sexual health and reproductive health topics are considered taboo or even heavy topics for families to discuss. Why is it important for families to discuss topics of sexual health and reproductive health? And how can families become more comfortable with these topics?
Thank you, Garvey. So part of the reason why it's important for families to discuss sexual and reproductive health goes back to the definition that I gave of health earlier, of overall wellness. So when we talk about health, we're not just talking about your physical health. We talk about physical, mental, emotional, spiritual. We want you to be overall good, living your best life, right? And one of those things that goes into your overall health is sexual and reproductive health. And so sex being a regular part of life, sex being how all of us got here to be having this conversation in the first place, you want your child, you want people in your family to be informed about sex, about their own bodies, so that they know how their body works, so they know how other people's body works, and so that they know so they are informed to make informed choices. A lot of times when people talk about sexual and reproductive health, they jump right into the physical aspect of sex. And I think that it's more than that. Sexual health is more holistic than that. It has to do with relationships. It has to do with emotions. A lot of times we don't talk about the emotions that lead to sex or the emotions that you might have after you have sex. Talk about your identity. How do you see yourself? How do other people see yourself? For a lot of people, their sexual identity is one of their primary identities that they have. It'll also help you to make informed choices in terms of, what do I want to do with my body? What do I want to do with somebody else's body? And those kinds of questions. And those are the things that kids shouldn't have to make those decisions on their own. They should be able to have someone, whether it's a parent or a mentor or a guardian, someone that they can go to discuss those types of hard topics, because it can be really complicated and really layered. And so if you start having those conversations and you have them early and you have them often and you break them down into small chunks, that can take a little bit of the taboo off of it. That can make it a little bit lighter. And using those teachable moments when you're watching a show and you may see something sexually explicit, or you may see somebody having a tough conversation about sex, that's a good time to integrate with your family and say, hey, when we watched that scene, how did that make you feel? What do you think that you may have done in that situation? And so starting to have those conversations early and often, I think, are really important for getting families more comfortable for talking about topics like sex and reproduction, particularly in the realm of health and keeping yourself safe and healthy.
Thank you so much. As you were talking, the kids looked over and were like, we do that. And I'm like, yes, we do that. We definitely. It's so true. Okay. And I'll just say, as a parent who has these conversations and has had them early and then has them often, it gets easier and easier with every conversation, every single time. All right. We're going to talk about our next question. So here we go.
You have an extensive amount of experience in the health field. Can you talk about your past work as a community health coordinator and what you learned about the barriers that kept families from attending their well-child visits?
Sure, I certainly can. Thank you for that question. So I talked about my origin story and coming to the field of public health from learning about HIV prevention and sexual health. One of the things that I ended up working with, or one of the populations I end up working with a lot, are children and families. And one of the positions that I had was as a community health coordinator. As a community health coordinator, I worked in community, and it was awesome. I'm so blessed to have had that opportunity because it set the foundation that would help me going forward for other positions that I would have, and thinking about keeping that social justice as a real focus in my work. And so knowing that when you're working with the health of the public, which is public health, centering the individual. So it's not like bench research where you would be dealing with like organisms or animals or some things, and nothing against animals, but when we're dealing with public health, we're dealing with real people who live in real communities, individuals who have real children. And so we have to be thoughtful about that. We can't just be paternalistic and think that we know what's best for people. And so as a community health coordinator, I worked with families to help them to maximize their health care. And so what I mean by that is, you guys know that you go, well, you may not know, your mom knows, that you go to the doctor, especially when a child is first born, they go on a very specific schedule because the doctor wants to make sure that they're developing at the rate that they are supposed to be. So making sure that your eyes work and your ears work and you're getting enough food and you're a particular height and weight for your age group. And so the work that I did as a community health coordinator was with families who were missing some of those visits. And what happens when children miss those initial well-child visits is that problems that maybe would have been really easy to solve if we had caught them earlier, they can turn into big problems that can impede a child's growth and their capacity going forward. So say, for example, a child is getting their ears checked regularly to make sure that they're able to hear. Perhaps if they had checked it earlier, there may have been something that they could do. But if their hearing is going out and they don't go to the doctor to know that something is wrong with the hearing, it can develop into a larger problem. And so with these families, we work with them closely to alleviate any of the barriers that they may have to getting their child to the doctor on a regular schedule. And for some of these families, the barriers included either having a low income or perhaps they were working jobs that paid them very low wages, so they had to work multiple jobs and they didn't have time to get their kids to the doctor. For some of the families, transportation was a big issue, because this is in Detroit, where they don't have a great system of public transportation. There's no train, it's primarily busing. And at that time, it was taxis. This is before we had Uber and Lyft. So people were having trouble getting their kids, physically getting them to the doctor. Sometimes parents were dealing with more pressing issues, such as food insecurity or housing, and other issues that would take priority over a doctor's visit. And so we worked with them to make sure that they had everything that they needed to be able to get to their doctor, be able to take care of smaller issues really quickly, and hopefully to set that child up so that they would have a more successful outcome going forward.
Just kind of not shocked, because I do completely understand what prevents people from going to well visits. Mm-hmm. But I think that there are a lot of people who take for granted, one, that they even have healthcare that they can use to go to a wellness checkup for their kids, but might not even be aware that the obstacles that other people face. So I appreciate you sharing that with us.
Yeah.
In the work that you did. So we're going to move into our next question.
Can you talk about your leadership and research on preventable diseases that manifest in low-income communities of color?
Sure. I thought about this question for a while because I've worked in a couple of different areas with disease. So I've worked in chronic disease with diabetes and rare kidney disease. And I've also worked in infectious disease, which is what I'm doing now in sexual and reproductive health. And the biggest thing I wanted to talk about was health disparities in this area, and the fact that I think people are very aware, particularly with the COVID-19 outbreak, was something that people in public health knew and have known for a very long time. But I feel like COVID was a opportunity for this to become a mainstream issue. And that is what we've always known, and what a saying that we use in public health is that when white America catches a cold, Black America gets pneumonia. So take almost any health issue, whether it's cancer, if it's heart disease, high blood pressure, any of those things that could impact anyone, right? Where nobody is immune to any of these illnesses. But when you look at the statistics, it's almost certainly, I think there's one or two health issues where it's going to be the outcomes for Black people in America is going to be worse. And COVID was a very blatant, and it became a very mainstream example. If any TV show you turn on, you're going to hear about more Black people dying from COVID-19. And part of the issues is because health issues are, like I talked about holistic health, is that you can't separate health from everything else, right? And so until we're able to set up our society in such a way that we're seeing more equality across the board, so people's job, people's housing, people's access to food, people's access to exercise, all of those things affect our health. And so that's one of the part of the work that I do at the center, and that's where the health disparity part comes in, is to work to create research that makes the case and provides evidence that these things need to change. And so we look at, a lot of our work is around HIV and STDs, and we make those comparisons and show that there are disparities in these issues, even in something as simple as violence, even though that's not necessarily like a disease, but we do see more, we point out things like health disparities in intimate partner violence, in HIV rates, in who is taking their medication and who isn't, and what are some of the barriers that people may not have thought of for marginalized groups and or communities of color that would prevent them from taking medication to make them less sick. And so the leadership that I do is making sure that our faculty and our staff have everything that they need to be able to do the research, to provide the evidence to make the case, to hopefully support change in policies.
All right. So that will then lead into this next question.
Your work has a social justice framework. Can you tell about what it means to center social justice in the reproductive and sexual health field?
Yes, Garvey, I can. Thank you for that question. To have social justice as your framework means that at its core, my work is striving towards equality so that everyone, regardless of how they identify, has a chance to live their very best lives. And this includes having access to things that they need to have a satisfying and meaningful sex life. And so that includes having access to healthcare that will support that. And so when I'm talking about healthcare that will support that, that includes prevention. So seeing the doctor to prevent anything before it happens. And so that you're checking in to make sure that you're developing in a healthy way and that you have everything you need to prevent any kind of infection. And for those things that aren't preventable, if you were to get an infection, that you're able to see the doctor for treatment to prevent the spread of that infection and to treat it from yourself as well. And in addition to preventing infection, you also, if you want to get pregnant, to be able to have the opportunity to get pregnant. And if you don't, or if you don't want to get pregnant at the time, then to be able to have access to stop an unwanted pregnancy. And then also for those who want to get pregnant and or pregnant, that they're receiving the proper care. And so we hear stories about women who are pregnant, have wanted to get pregnant, are carrying a pregnancy, and they go to the doctor and they may not have the best care. And we even see that regardless of income levels, not that a higher income should entitle you to have better care necessarily, but even in the event that someone has a higher income, that race still plays a factor. So we see that Black women have higher rates of death in childbirth in the United States than white women. And we hear anecdotal stories from people like Serena Williams and Beyonce about disparities that they've received in care during their maternity time as well. And so the work that I do is making sure that these things don't happen and providing, again, like I said earlier, the evidence of these things happening so that we can instate policies that try to fix these inequities.
Is there a research project or published piece that coming out you'd like to share? Can you share a bit about the finding?
Sure. Thank you so much, Sophia, for that question. So we talk about, I'm going to talk about published pieces first, because that's one of the things that where I work right now, the Center for Sexuality and Health Disparities, that we do very well is with our research. We do a research project, we get information, we come to conclusions based on our research, and we publish, and those things get put in scholarly journals. And scholarly journals are what other researchers read to find out what other researchers are doing. And one of the things that I'm most passionate about is making sure that our research findings get to the people that we are researching and get out to the public. And so one of the things that I've done at my center is create a community report. And what that is a highlight of our published work. And it's written in very simple terms so that pretty much anybody could read it. I had we broke down a lot of the language and some of the complicated terminology and the hard math, because there's math that goes into research as well, and just gave you like the summary, the bottom line of what it is that you would need to know for about 25 of our publications last year. And we're going to do another one next year and just try to keep that current so that we can continue to provide information for our students, for our partners, for individuals who have participated in our studies, because we can't do our studies unless people answer questions for us or provide their blood samples or their urine for us to understand what's going on in their bodies and in their minds for the decisions that they make around sexual health. And so we provide this report for them. And we did our first one last year. It's on our website. And if you'd like to check it out, to learn more about the research, the published research that we've done through the center last year. In terms of studies, there's two that I'd like to talk about. We have a lot of research going on, at least anywhere from 15 to 25 studies going on at a time at our center. Currently, I'm working on a project called Masks, And it's a small project with, and it was the idea of one of our staff members looking at the role that masculinity plays for individuals that identify as transmasculine, the role that masculinity plays for them in their health decisions. And so when we talk about masculinity, it's those things that are more so associated with men, male, masculine people. And so some of the kind of traditional things may be like a short haircut or drinking beer, the things that we see when on Father's Day they advertise, buy some tools for your dad. And so looking at when people conceptualize masculinity for themselves, what are some of the decisions that they make and how do those things affect their health outcomes? And so it's been very interesting. I've learned a lot, and I'm really excited about some of the papers that we're writing that hopefully will come out at the end of the year. And then the last study that we're doing, or another example of a study that we're doing, is a study called We Prevent, and it is about for couples, for same-sex male couples, and looking at providing them what we call an intervention. And so that is giving them something to that may or may not change their behavior, and finding out if that thing changes their behavior. And so in this instance, it is a counselor providing a counselor for male couples to help them to communicate better and see if that improves their outcomes for STD and HIV. And so allowing people to talk and have better conversations and decide the decisions that they want to make sure that they're on the same page. And so we're hoping that, or we'll have a better understanding if that kind of counseling supports and lowers the rates of HIV for male couples.
Wow. A lot of really awesome information, tips, advice, wisdom, insight. Renee, thank you so very much for joining us on the podcast. We are so thankful for everything that you've shared with us and our listeners.
Thank you all so much for having me. This is great. And I hope to talk to you guys again. And I'm really looking forward to doing more work around getting information out to the public. There's so many things that we just need to know and talk about. And so thank you for this opportunity.
No, thank you. We challenge parents to start discussions on wellness and reproductive health if they haven't already. These discussions are important for preparing your kids to be confident enough to self-advocate and to stand up and advocate for others. We need to begin to acknowledge that our own individual health and our family's health is tied really closely to the health and wellness of those around us, near and far. If you have any cool epiphanies you'd like to share, please leave them in the comments or share them with us on social media.
Each episode, we will share quotes that we find inspirational, and sometimes we will share what we think they mean. My quote is by Barbara Smith. She is a teacher, author, scholar, and Black feminist thought leader. Her quote: "Black women as a group have never been fools. We can't afford to be." My quote is by Sonia Sotomayor, an American lawyer and jurist who serves as an Associate Justice of the Supreme Court. My quote is, "Look, disappointment and uncertainty are constant companions in life's pursuits. Being a little frightened is natural and unavoidable." Sonia Sotomayor.
Michelle Obama is a lawyer, author, and was the First Lady of the United States from 2009 to 2017. As First Lady, she worked as an advocate for poverty awareness, education, nutrition, physical activity, and healthy eating. Her quote: "Women in particular need to keep an eye on their physical and mental health, because if we're scurrying to and from appointments and errands, we don't have a lot of time to take care of ourselves. We need to do a better job of putting ourselves higher on our own to-do list." What do these quotes mean to you? What's your favorite from the ones that we shared? Let us know on social media using the hashtag #Let'sK12Better.
Thank you for listening to the Let's K12 Better podcast.
Please like, subscribe, and share.
We want to hear from you. Connect with us on social media at Mom of All Capes everywhere, and follow the Let's K12 Better podcast on Twitter, Instagram, and Facebook. Share your thoughts about this episode using the hashtag #Let'sK12Better. That's hashtag LETSK12BETTER. You can now find us on your favorite podcasting app.
See you next time.